absolutely it impacts us here. And I work at San Francisco General, and there is a connection, right? Because when we got to discharge people, this is where we have to send them. And if it's not here, and people don't feel like there's an urgency about it, we don't hear any public conversations about it, it's almost like it's a secret. Whatever's being done is being done in secret and not in the open.
You know, you brought that's a really good point. If you had the chance to really give someone a quick bite of
My name is Steve Zeltzer. I'm with the United Front Committee for Labor Party. We're here today in front of Laguna Honda Hospital to demand that they reopen the beds, they stop the threat to shut down this hospital. This hospital is a resource for the people of San Francisco, for working people, poor people, black and brown people. They need it. And at the same time they're threatening to shut down the hospital, there's a racist campaign against the employees here in the city and county of San Francisco. And today, while the city says it doesn't have money for enough staff and resources, they got all these sheriffs here who try to prevent people from going into the hospital where we're going to have the press conference. So their priority is to try to shut things down and voices down instead of really doing what they should be doing. So we're here, we're speaking out, and we're saying that Xavier Becerra, the Secretary of Education and Labor, should abandon plans to demand that this be shut down, and we need to keep this open. We need to expand it. There are a lot of people who need to go to this hospital and aren't being allowed to go here. So our first speaker is Brenda Barros, who's the president of the SEIU 1021 General Hospital Chapter. Welcome, Brenda.
So I'm here to say, and I have to be careful with my words, because there are, oops, can you hear me?
Hold on.
Okay.
No, yeah.
Okay. Yeah, so there are people that want to silence us. And so I'm here to say we will not be silenced. Javier Becerra, you need to do your job and protect the people here in San Francisco, and particularly these patients that are in Laguna Honda Hospital. It's outrageous what has happened. I know there are a lot of efforts trying to keep the hospital open, but the discharges of these patients needs to stop. We cannot have these people be discharging, and what brought me here is hearing about the deaths of the people that were discharged. And there are a lot of other issues which are causing similar situations in the workplace. I won't go into detail, but this needs to stop. I know the people of San Francisco don't want, they're good people. They want to help people. I know most people in San Francisco do not want Laguna Honda to close, but I also know from talking to people, a lot of people still don't know what's happening at Laguna Honda. So they need to be a lot more public about what's going on at Laguna Honda and letting the public know about it. Because I know people with on waiting lists who parents need Laguna Honda who can't get in. And it's impacting their ability to work. So please, please, everybody, make sure Laguna Honda stays open. The people that work there are good people. And they want to do a good job for the patients, and they do a good job for the patients. But they need the right staffing to do it. They need support from the community to keep Laguna Honda going. So to the community, I'm saying you need to speak up and start the conversation about Laguna Honda so that we can make sure that Laguna Honda never closes and that it's always here for the people of San Francisco.
Cheryl Thornton is our next speaker, and she's a healthcare community worker in San Francisco and also vice chair of the community care chapter of SEIU 1021. Welcome, Cheryl.
Good afternoon. My name is Cheryl Thornton, and I'm here today to speak out about the closure of Laguna Honda. This is about the people. This is really about the people. The people are the ones that formed Laguna Honda and started. It was for working class people to have somewhere to have respite when they needed it. The working class people of San Francisco who built this city. And so I'm out here today to speak against the closure of this. I don't know what happened, how things were mismanaged. I heard I heard the narrative that has been given to the public, but there should have been oversight. This should have never been allowed to happen in the first place. But at this point, we need answers. It's gone very quiet. We don't know really what's happening. I still am hearing that some people are being discharged because there's actually a different criteria that they're using, and they're being discharged to primary care and to shelters. I don't know how many people, but people are still leaving this hospital under some type of process. So we, the public, I'm a San Francisco resident, I'm an SEIU Tenderloin member, we deserve to know what's happening. I mean, somebody like myself may have to use this hospital one day because I cannot afford, because this is the most expensive city in the nation, I cannot afford maybe to have long-term disability care. I can't afford to purchase it because I'm trying to survive now. So I think that we need to preserve this hospital. And secondly, I want to say, like what Brenda said, I won't be censored. I feel that for speaking out about the privatization, the gentrification, the discrimination, all the oppressions, all the isms, that we are now being censored. So I'm just here to say that I am an American citizen. I am entitled to my rights to speak out. I am entitled to report crimes, good faith reports of crimes, and not be censored. So thank you, and power to the people. We need to keep Laguna Honda open.
Thank you, Steve. My name is Charles Minster. I'm retired trade unionist. Worked for the city the last 3 years of my employment. I just want to give you a couple anecdotal things to set things in perspective here. I was up there. I was expecting the press conference to be in front of the administration building, but I needed to use the facilities. So I went into the hospital to use the facilities. I was immediately confronted by 3 sheriff's deputies, one of them with a wand to check to see if I was carrying any weapons. And then when I wanted to go to the bathroom, they told me I had to put I had a mask on already, they told me I had to put a shield on to use the bathroom. Now this is the kind of stuff you got to deal with here. Now, I have 2 close friends. Both of them lived in the city over 35 years, both worked in this city. One of them is they're a married couple, and the man worked in the city until he retired, and then he had 3 heart attacks over a 2-year period. The last heart attack, he wound up being paralyzed from his waist down. His wife, meanwhile, is suffering from brain cancer. She took care of him for 3 years, and the doctor told her she couldn't do it anymore, and she had to get into a hospice or a care home. Now, they're not rich. They work their lives. They're working stiffs. Tried to get in here. No, couldn't get in here. She had to get him into a place in Union City. And she doesn't drive or have a car. So these are the kind of things that what's going on here is affecting. I'm all for taking care of the homeless, but let's not put them in here, in this hospital, and kick out the working people that built this city and built this hospital. I get a newsletter from Nancy Pelosi every week about what she's doing for us. Well, the one I got yesterday, the top of the list was, we're sending $12 billion more to the Ukraine to kill and maim. I didn't see anything down there about health care, senior housing, nothing that benefits the people of this city, only to benefit the rich and their imperialist aims. Until we have a working class party and a working class government, we're not going to get, they'll close these hospitals or turn them over to private citizens. We need to nationalize all health care without compensation and have the workers who run these hospitals be in charge. No longer can it be put in the hands of bureaucrats and administrators and bean counters who are looking to make money off of everybody that goes into a hospital. And only a workers' government can guarantee that. Thank you.
As Charles said, we were scheduled to do the press conference in front of the old entrance, and it's blockaded. They have sheriffs. They've probably mobilized a lot of sheriffs in San Francisco to come today to Laguna Honda to stop a press conference. Now, why would they do that? What are they so afraid of, these people? Are they afraid of the public learning what's going on here? I mean, they've got them guards. They've got, you can't walk up there to Laguna Honda. I mean, it's really a state of attempting to shut down free speech, attempting to shut down about the fact that they're still planning to close this hospital. That's what they're really trying to say. They're planning to close it because really the developers want this land. The way the developers think, this land is too valuable to have a hospital on. It's too valuable. What they need is to have condos on this land. That's what's really going on in San Francisco. And it went on at City College, where they sold the Balboa Reservoir to a for-profit developer, Avalon. Instead of giving it to City College to expand City College, they gave it to a developer. And for $11 million, it's worth a couple $100 million, that land. So the corruption, and that's also what we're talking about, is endemic in the city and county of San Francisco and all over this country. The corruption, the developers run things, and they want these politicians to do their bidding. So we're here today really to defend this hospital, to demand that they expand it, they don't shut it down, and the state of California, Gavin Newsom, Xavier Becerra, they keep it open, and Nancy Pelosi, who's supposed to represent this district, should be speaking out. She should be here protesting the threatened closure. Instead, she, as Charles said, wants to give $12 billion more for a war in Ukraine. They've got like $60 billion for a war in Ukraine, but they can't keep this hospital open. They can't expand it and have the proper staff. That's what we're saying. So solidarity, brothers and sisters. The last point I want to say is the rampant racism that's going on. Because at the same time they're trying to close this hospital, prevent working class people from going, they're harassing and bullying black employees in San Francisco. And this has been going on for decades. We got to put a stop to that. And workers have to stand up and speak out about it. And we have to mobilize the labor movement. So thank you, brothers and sisters. Solidarity.